As I finish up here, and that is about the Department of Labor and how they have announced the national unemployment rate that has reached 10.2% during the month of October. Another report shows that businesses with less than 50 employees lost 75,000 private sector jobs in the month of October also. Small businesses and individuals and families have been devastated by this 26-year high unemployment rate. And here we are, Mr. Speaker, during this important debate in our nation about health care reform, talking about raising taxes on small business during this recession. And Mr. Speaker, I personally believe, and I think a majority of us believe, that small businesses are the economic engines in our communities and our state and are the way that we can help lead our nation out of this recession. But yet, as we look at the health care reform bill that we're getting ready to take up, and you look at different sections of it and how it will affect small businesses and job creation and unemployment, I am deeply concerned about several sections of this piece of legislation. An example is page 297, section 501, would impose a 2.5% tax on all individuals who do not purchase bureaucrat-approved health insurance. And this tax would apply to individuals with incomes under $250,000, thus breaking a central promise of the President Obama's presidential campaign that we would not be taxing people under $250,000. Section 512 on page 313 imposes an 8% tax on jobs for firms that cannot afford to purchase the bureaucrat-approved health coverage. And according to an analysis by a Harvard professor, such a tax would place millions of people at risk for unemployment, with a majority of those workers could be minorities who we believe would lose their jobs at twice the rate of their white counterparts. Section 551, page 336, imposes additional job-killing taxes in the form of a $500 billion surcharge, more than half of which will hit small businesses, according to a model developed by President Obama's senior economic advisor, which could increase taxes and cost us another 5.5 million jobs. And of course, we know that this piece of legislation also adds $729 billion of new taxes on small businesses and on individuals who cannot afford health insurance coverage and employers who cannot afford to even provide that health insurance. And of course, another $1 trillion of new federal spending on expanded health care insurance coverage over 10 years is some of the projections of this health care bill that we're getting ready to take up. We have had several different groups express concern about small businesses, about the unemployment rate, about the cost of this proposed health care plan. The NFIB has estimated that 1.5 million jobs will be lost due to the employer mandate on small businesses. That nearly 1/3 of the uninsured workers who earn within $3 of the minimum wage will be put at risk of unemployment if their employers are required to offer insurance when 1 in 10 Americans are unemployed already. It's a bad time to be mandating these new tax increases on our small businesses. We know that the pay-or-play provision could reduce the hiring of low-income workers and that those wages could fall even more because of required mandates on health insurance. And this bill that we're talking about for health care is going to leave what we believe 34 million Americans without health insurance because of expansion of Medicaid, and millions of Americans will lose their current health care coverage if the private sector market is driven out of the marketplace that offers insurance. According to a 2009 study by the National Federation of Independent Business, the cost of health insurance is the #1 concern to small business owners. Small businesses create 7 out of 10 new jobs in the U.S. and should be able to provide their employees with health benefits and should be able to provide it at a reasonable rate that helps these small businesses be competitive, but yet offer one of the vital benefits that they can provide to their employees, which is small businesses. The Kaiser Family Foundation reports that health insurance premiums for single workers rose 74% for small businesses between the period of 2001-2008, and administrative expenses for small group plans account for 25 to 27% of premiums compared to that of 5 to 10% for large businesses. And so what we know is, Mr. Speaker, that if we impose more taxes, more mandates, more surcharges on our small businesses at a time when our unemployment rate just hit a record high for 26 years, over 10%, that our small businesses are going to be further devastated by any type of health care reform proposal that has a government mandate, that has new surcharges, new taxes, huge new taxes on small businesses. And Mr. Speaker, I'm very concerned because small businesses are the economic engine of our local economies. They're the way that we can lead ourselves out of this recession, and that is why I will be opposed to the current health care proposal by Speaker Pelosi, and I will yield back the balance of my time.
Reserves her